So when does it become a community transmission? Can you help our viewers understand?
Yes. The last few cases before today were cases that occurred in patients or people with a history of travel to China or more specifically to Hubei province. The few cases we've seen today, in fact, changed that trend. These are people who have no history of any travel to China. And in fact, when we did contact tracing, we found, in fact, they were linked with a travel group that themselves had come from China. And we believe that's how the transmission has occurred. The cases all seem to be related to this same link, and we can account for that this form of transmission. So while this is a local spread, we don't think at this point in time that we have any evidence to suggest that, in fact, there are other people who are spreading this illness in Singapore. What I'll be looking out for would be whether or not there are any other cases that come on. They're not linked to this particular group of patients or to the group of travelers that come from China, this particular group. And if I cannot account for any link with travelers from China, that raises my concern that there may therefore be someone else in the community spreading that constitutes community spread.
Okay, got it. So let's just talk about contact tracing. Can you just give us a little bit more clarity about that? Because not much information is shared about the tour group, about these locally transmitted cases. Can you just tell us how exactly contact tracing is being done?
Yes. Well, contact tracing still continues for this group of people. So the information still continues to come in. We don't have all the information in just yet. But in general, what we do with contact tracing is first to interview the patients that we have, to find out what their movements are like, where they've gone. And in fact, sometimes we also corroborate that with checking phone records, travel records, taxi records, and so on. And once we get a picture of where they've gone, we then find out who they've been in contact with. We then contact these individuals and people they've been in contact with, find out how they're doing, whether they're sick, whether they're well, and assess their own individual risk of being exposed to these patients. That allows us then to decide what to do with them.
So we know that there are 524 people being quarantined in Singapore right now. In terms of those for close contact tracing, what are your latest figures on that?
My understanding is that contact tracing continues. I think that we've had about 311 people that continue to be on our contact tracing.
Well, the other thing I want to ask you is about the fact that there is a 14-day incubation before anyone shows any symptoms.
That's correct.
Isn't that worrisome?
Well, it is in the sense that it means we need to keep individuals under surveillance for that 14 days. And in fact, from the time that this outbreak has occurred, we still have people in the community that are within that 14 days that we continue to keep a close watch on. As you know, we've in fact put in some travel restrictions, and we've put in various measures to perhaps limit the at-risk group of people that are present in Singapore. But the cases so far that we see, in fact, relate to people who've had exposure to travelers even before travel restrictions have taken place. So from that perspective, we think there may still be that possibility of more people coming out with symptoms and subsequently being diagnosed with this infection.
Now, let's just talk about the origins of the infection for all the previous 18 cases. Can you confirm that they are all imported cases?
Yes, and they all have a travel history linked with Hubei province. In fact, very specifically, most of them, in fact, had specific travel from Wuhan city.
Also, let's just talk about the yellow level of the government's DORSCON framework. What does this mean? And I'm just wondering, what will it take to bring us to the next orange level?
Yes. Well, we have a risk assessment system which allows us to assess what the risk is of spread in the community. At this point in time, we remain in what we call DORSCON yellow, and that means that there is no signs of any spread from cases that we cannot account for in the community.
Now, prior to today's developments, there were 18 confirmed cases with no new cases for 2 straight days. Let's take a closer look at the patients. First, the virus doesn't discriminate. Men and women have both been infected. Age-wise, it's also affected both younger and older people. And after putting together all the information on the first 18 patients, we have come up with this graph. The 7th patient was discharged just today, as indicated there. Now, we've color-coded the case timelines into 4 portions. The blue area is when they arrived in Singapore. The yellow is when they started showing symptoms, as reported by the Health Ministry. And the orange is when they were notified as suspect cases. And the red is the date they were confirmed as cases. Now, taking a broad look, we can see that days can pass from the time of arrival in Singapore till when symptoms show up. These 4 cases, for example, they spent around a week in Singapore before symptoms emerged. Plus, we don't know when exactly they were infected, meaning they could have been carrying the virus even before reaching here. Experts say the virus has a roughly 14-day incubation period. Another observation that it can take a while between symptoms starting to show and when one is notified as a suspected case. Now, look at these 2 cases. This can last up to a week, and it's still unclear why this is so. The Health Ministry has not specified the exact reason, but the ministry has been constantly urging those who show symptoms like cough, fever, and runny nose to wear a mask, wash your hands, and go see a doctor. Another unknown, how exactly the coronavirus is transmitted, but there is a clear trend in these cases that there was exposure to another infected patient. For instance, the first and third patients are father and son. There are also 2 pairs of cases where the patients were traveling companions. Now, there is a married couple who were diagnosed one after another, and one was a close contact of another patient. Okay, so Professor Mak, perhaps you can just elaborate more about, you've mentioned what it takes us to get up to the orange level, but what kind of added measures and actions will orange level actually bring?
If we move into what we describe as DORSCON orange, that means we believe that there's spread of the infection in the community itself. It would be reasonable then to consider a suite of measures which includes some degree of social separation. That may include discouraging members of the public then to gather together in crowded areas. We would give serious consideration whether to cancel mass events, and we would also, in particular, encourage some level of for business continuity in companies, making sure that they, in fact, have sustainable practices that allows them to continue their practices if any employee or any individual in the company then gets sick.
Can you just also help us understand about this enhanced screening for all pneumonia patients in Singapore? How many cases do we have at present? And I'm also wondering if this will actually create existing burden on the current healthcare staff.
We currently have patients, in fact, who are admitted in hospital for pneumonia, and on average that would be somewhere between 500 and 600 patients admitted in hospitals per week. What we have done, in fact, is to investigate whether any of them possibly could have pneumonia due to this infection. So in addition to the normal investigation and tests that they currently have, we have now started adding a test for this particular virus as well.
Now, from China's side, we hear that their situation is going to peak sometime this week or the next week. Whereas Singapore, we are sort of, what the Minister Gan Kim Yong says, we are prepared for a long-haul fight. Can you just elaborate what kind of timeline are we looking at?
Yes. Well, we are very encouraged by the Chinese saying that they believe that they may have some control on the outbreak they have, and they hope, therefore, that this might peak within the next few weeks. We've noticed that when it comes to the trend of cases that come out, we lag China by a few weeks as well. So while they are confident that they may have control, we continue at this point in time to still continue seeing an increasing trend of cases. And therefore, we continue to be on our guard to make sure that if any cases come, there is no spread into the community. And therefore, our measures are intended to do this.
Right. So again, timeline for Singapore, what are we looking at?
So we think there will be more cases that will come out, and these cases would be related to some form of exposure to travelers from China that may even have taken place before we impose various travel restrictions. So that risk still remains related to the pool of travelers that continue to be in Singapore. But if the number of cases peaks, that may take place perhaps in a few weeks' time, not so soon. Okay. With the experience from previous outbreaks, both in Singapore as well as internationally, we know that it's not always easy for an outbreak to settle very quickly, and sometimes it may take as long as 4 to 6 months or even longer. So from that point of view, it's quite reasonable to prepare ourselves for that long haul in case, in fact, it does continue for that long.
Okay, well, thank you very much,
Thank you.
Kenneth Mak, for joining us today. And there I was talking to Kenneth Mak, Director of Medical Services at the Health Ministry.